Phil, you see a lot of knee pain and you get a lot of knee pain referral. Can you explain to us how the lower limb mechanics and the orthotics relate back to treatment of the knee?
Yeah, definitely, Bruce. The knee is something that we see a lot as far as knee pain goes, particularly around the patella, retropatella, and just simple conditions where you get crunching and grinding, and people who are alarmed with the fact they can feel this going on, I think they have maybe an arthritic mechanism occurring. Now, what happens with the knee is, if we look in this area here, we do get these common symptoms which occur around the knee. Many people, maybe at the same time as seeing me, are seeing a physical therapist or a practitioner who specialises in the treatment of knees, and they give strengthening and stretching exercises for this particular region, the rectus femoris area, vastus medialis oblique. But at the same time, I suggest that practitioners look at the foot. And the reason why I say look at the foot, sure, you can see a lot of these mechanisms occurring in the knee joint, around the patellofemoral path maltracking problems. But on hard, flat ground, the calcaneus everts with a pronatory effect occurring in the midfoot or mid-tarsal joint. And what happens is that for every degree of calcaneal eversion, you get an internal rotation of the tibia. So if I do it in an anterior view from anterior to posterior, as the foot pronates due to the hard, flat ground, and maybe I can demonstrate this with my hand. Imagine this is the arch, the heel, the arch and the forefoot. As you pronate, you get this internal rotation of the tibia. Okay. Now the tibia is connected to the knee joint, which is generally a hinge joint or gingivalis joint. You also have the hip joint, which can get quite a fair bit of amount of rotation in the transverse plane. So the first thing that complains is the kneecap. So what I normally suggest with the treatment of knee pain is a study of the foot, and if there is this excess pronation, which in many cases there is, the use of an orthotic to reduce the transverse motion of the knee, and again, the treatment of the knee from a rehabilitatory process, whether it's weak VMOs or inflammatory processes involved with that. With knee pain, commonly patellofemoral pain, retropatellar pain, anything in regards to medial or compartment pain around the patella, we find that we get a component or a high component of pronation due to the hard, flat ground. In that respect, if we bring the subtalar joint back to neutral, we get an incredible improvement in the arch position due to locking of the mid-tarsal joint, but more importantly, we reposition the knee in the sagittal plane, so we take off this transverse plane motion that causes problems in the patellofemoral tracking process. Now just relax the knee. If we look at the knee, it's now internally rotated, and if we zoom into the knee, you will see a small texture mark. And remember, the knee is in the pronated position now. If we bring the subtalar back to neutral, you'll see that the knee or the patella is now pointing in the sagittal plane, and this reduction in transverse plane motion is what is used to treat patellofemoral pain via the use of an orthotic.